Hey everyone, so we're going to be doing some clinical massage and we're going to direct it this time to the medial shin, which really important area. Couple of reasons why. It gives us access to the deep toe flexors. It's also a site for where a lot of athletes, especially the running athletes, get medial shin pain, or if you want to call it, shin splints. So it is an important area, especially for, you've got your athletes that are maybe just overdoing it at a touch in that sort of either the pre-season of their competition. So this time we're going to use a little bit of the Activate, which is one of my favourite creams in the massage range. Primarily one, because it just smells so great, but it also has some wonderful qualities in the fact that it's got magnesium and caffeine and that beautiful mint smell. All right, so just really broad application first to the whole medial shin area, and that means we're going to incorporate the gastro head, and also down here we've obviously got our soleus. But as we come along and we delve off those muscles in there, that deep compartment there, that's where we're going to find, tib post. We're going to find a little bit of popliteus and obviously flexor dig. So we're going to harness a little bit of work onto the actual trigger points there first. But let's just get our client and our athlete used to the pressure through that area. Keep it broad to start with. So I'm going to use my middle finger. It's going to come up against the tibia itself, and that's going to be my bony landmark and guide. So I'm just going to work and sink through that tissue, make sure it's comfortable for my athlete. Make sure that you check in with them. All right, so it's nice and broad, all the way up and then off, okay? So just spend a little bit of time sinking in, getting a bit of an idea of gauge your depth in terms of what your client can handle. And once you've got that under control and you feel comfortable with that depth, then we're going to just swap over and we're going to use a little bit of the original, okay? So once gone, that's the grippier cream, and it's just my go-to for working, more small specific areas and especially those trigger points. So if we come all the way up, we'll find obviously the condyle of the tibia. We want to come down there, and about 1 or 2 finger widths down from there, you'll find the trigger point for the popliteus, which obviously unlocks the knee when it strides. So that's a really important trigger point. So just sinking into that area and just working really short strokes using that middle finger there. Make sure that that's all right and comfortable. How's that, Grace? Yep, pretty sore, but tolerably comfortable. She can handle it. If she wasn't, she'd obviously be giving me some verbal cues. All right, so once we can do that little bit of work into that popliteus, if we come down another finger width or 2, then we're going to hit the trigger point for the tibialis posterior, which another extraordinarily important muscle. Obviously controls the foot placement when we heel strike and through. So as you can imagine, another one of the deep toe flexors. And then its sister muscle, if we come down a little bit more, so another 1 or 2 finger widths, is that flexor dig. So that's another little area, another trigger point we can work as well. So we've got 3 little gems: popliteus, tib post, and then that flexor dig. All right. Now, just every now and then I get my clients just to wriggle their toes a little bit for me, and that just helps me engage those tissues a little bit better as well. And you can probably feel them moving underneath your fingers. All right. So just be really purposeful, work through those. Okay. Make sure you got your pressure right. You're not pushing too much. You're not digging in too much, and you're not massaging the bone either. Not ideal. All right, so just to recap, a little bit of Activate first. You want to get broad range of techniques going, get comfortable with the pressure in that area, especially for athletes who haven't had much work in that area beforehand. And then we could swap over to the original and hit that popliteus, tib post, and obviously the flexor dig trigger points. And that's a little bit of clinical massage for our medial shin.